Welcome to One Training, where we provide health and fitness content to help you achieve your goals. Choose the fitness course professional athletes trust. Click the link in the comments to learn more.
Hi guys, in today's video, we're going to discuss a case study for a client called Micah, okay? And we're going to look at how his health risk factors can affect his participation in an exercise program. So again, we've started with the case study of Micah, and Micah has hypertension, which means he has high blood pressure. So it's important to monitor Micah's blood pressure during exercise and avoid any activities that are going to increase his blood pressure. So to manage this and to try and improve his cardiovascular health, we're going to gradually progress his, the intensity of his sessions, but also, from session to session, we'll do that very gradually, and try and focus on Micah's sort of breathing and suggest specific techniques that he can use when he's participating in this program, okay, purely to keep his blood pressure down. So Micah also has high cholesterol, which is going to increase his risk of cardiovascular diseases, okay? So regular exercise combined with and having an approach in unison with a heart healthy diet we talked about, or something that's going to be aware of focusing on improving his cholesterol levels, okay, is important. We also need to think about if he's on any medication, okay, because some medications can affect what he does during his exercise program and vice versa. So making sure that we refer out and we have some line of communication with his with an allied health professional of his choice, or someone that has an area of expertise in that with that condition is super important. The third condition he has is high blood sugar. Okay, so this doesn't mean he has diabetes, but it means that he's at very high risk of developing it. But either way, he has some issues with regulating or leveling out his blood glucose. Okay, so obviously, when we're exercising, we rely on blood glucose for energy. Okay. So we need to keep an eye on how he's feeling before a session, during, and after. And generally, the best way to keep on top of this is going to be through the timing of meals and any medication he may be on. Okay, as well as we can modify the program with specific or limited intensities, and also being mindful of the duration. Okay, so if he is feeling a little bit lower, we might work in a lower intensity and shorter duration session, whereas days where he's feeling okay, or like it's under control and it's staying that way, we could exercise it at a higher intensity and potentially for a slightly longer. All right. So the last risk factor we've got to be aware of is chest pain and dizziness during exercise. Okay, so he's mentioned that he has experienced these before, and again, we need to take these seriously because they could be, in some cases, a precursor to a heart attack or stroke or something like that. All right. So again, this is where it's really important to have that line of communication with a referral team, with an allied health professional, to see if we can identify any underlying causes, and also get some advice on how do we change or restrict his exercise program, or any recommendations to not exacerbate these systems. Okay. So considering all these health factors, again, this information and having that, like we mentioned, communication and advice from allied health professionals is going to help us create the best program to address his risk factors. So focus on his cardiovascular health, his blood pressure and blood sugar management, as well as just his overall well-being. Okay, so regular communication with his AHPs is essential, and also just being careful of his risk factors when putting the exercise program together and choosing exercises. Okay, if we follow both those two procedures, okay, we're going to be able to create a safe and effective plan, a workout, I should say, that's going to improve his overall health and ideally help manage his conditions. Okay, so that's it for today's video. I hope you found that helpful.